Hello, this is Nelton Tobias, and I am an undergraduate medical student at KCMU Core, situated at Moshi, Kilimanjaro, Tanzania. And today I'll be discussing about dysthymia. On the introduction, dysthymia is a chronic depression whereby a person is in depressed mood most of the time for a period of 2 years, and it's also known as persistent depressive disorder. To diagnose this disorder, we use DSM-5 criteria, whereby it consists of like three categories: A, B, and C. So for category A, the person should have a depressed mood for the majority of time for at least 2 years, in which in children or adolescents it should be for at least 1 year. So criteria B, at least two features should be present. Two features of the following: poor concentration, poor appetite or overeating, insomnia or hypersomnia, low energy or fatigue, and low self-esteem. So either two of those features should be present. And the last criteria, it should be during the 2 year period, the person has not been symptom-free for at least more than 2 months at a time, and may have major depressive episode or meet criteria for major depression continuously. But also in those 2 year period, the patient must never have had a manic or hypomanic episode. This would make the diagnosis of bipolar disorder and not dysthymia. So, so the patient should never have had a manic or hypomanic episode because it will change the diagnosis. So the patient could be having a bipolar disorder or psychothymic disorder, because even in those disorder, the patient is in a depressed mood for at least 2 years. So in the epidemiology, 12 months is prevalence, which is 2%, and it is more common in women. And the onset is often in childhood, adolescent, and in early adulthood. So for the treatment, combination therapy such as psychotherapy and pharmacotherapy are more efficacious than using one type of therapy alone. And in psychotherapy, the therapist may use cognitive therapy or interpersonal therapy or insight-oriented therapy. The medication used are antidepressants such as selective serotonin reuptake inhibitors or selective norepinephrine reuptake inhibitors, but also novel antidepressants such as bupropion and mirtazapine. But without forgetting tricyclic antidepressants and monoamine oxidase inhibitors, they can be used. That marks the end of my presentation. Thanks for watching this video, and please subscribe to my YouTube channel, which is called Cerebral. Thank you.